Hi guys, this is Steve Neufeld. I want to talk to you for a moment about ankle arthritis. I've had a lot of patients recently ask me the difference between an ankle replacement and an ankle fusion. First, I thought I would like to clear up what ankle arthritis is. All of our joints in our body, our fingers, our toes, our ankles, our hands, they all have cartilage in them. And cartilage is the slippery surface that lets our joints move without pain. So I just wanted to show you an example of a knee with arthritis. In this model, the arthritis is this red, raw bone. And you could imagine that if it doesn't have the blue or white cartilage covering, that raw bone is scraping against the other side of the joint. So that when the joint moves, if there's no cartilage, it hurts. And arthritis is painful and it's stiff and it's crunchy and it's very disabling. And that's what arthritis looks like. It's missing cartilage and bone is exposed. Well, any joint in our body can have arthritis, and including the ankle. And there are a couple different ways to treat arthritis. The first is to treat the symptoms with Advil and Motrin and Aleve and anti-inflammatories and things like that. Or the second option is to replace the arthritis joint. So by removing this bad joint and replacing it with an artificial joint, such as an ankle replacement, the pain goes away. So here's an example of an arthritic ankle that was replaced with a metal and plastic joint. And notice that the joint moves up and down very nicely. The last option to treat ankle arthritis is to actually stop that joint from moving. So if the joint is fused and those two bones don't grind on each other anymore, guess what? They don't hurt. Now, why would somebody choose an ankle fusion, which sounds very awful where it doesn't move, versus an ankle replacement, which does move? And let me explain that to you. It's very simple. An ankle replacement is an artificial joint, and artificial joints don't last forever. It's made of plastic and it's made of metal, and eventually that joint will wear out. So if you have many, many more years ahead of you with lots of running and jumping and very high activity levels, then an ankle replacement may not last your entire lifetime, and you may need a revision or another surgery to fix the ankle replacement that's failing. Now, having said that, we're very good at ankle replacements. The technology is getting better and better. But an ankle fusion, on the other hand, will last forever. Once that joint is fused and it doesn't grind, it doesn't hurt anymore, that will last forever. And the reason why it works, and even though it sounds very daunting, is that all of the other joints in the foot will compensate and will move in case that ankle is fused. So, what are the indications for ankle fusion versus ankle replacement? I think somebody who's younger, who's very active, who wants to jump on it, who wants to hike, who wants to work on uneven surfaces. And ankle fusion is a little bit more robust. And in fact, it's such a great operation that somebody who has an ankle fusion doesn't even know they have an ankle fusion. I wanted to show you an example of one of my patients who had an ankle fusion. You'll notice as they walk, you can't even tell that their ankle is fused because all these other joints will compensate for that frozen ankle, and the patients are very, very happy. So if you have painful ankles, I think you should talk to an orthopedic foot and ankle surgeon to get an idea if you are a good candidate for an ankle fusion or an ankle replacement. Either one of those operations is a great operation. They will relieve your pain, but different people need different things. So thanks for listening today.